I work in a field of psycho-oncology, which is kind of broadly working with cancer patients. I chose my specialty a little early in terms of finding that psychology existed in hospitals when I was an undergraduate, and really learning just how important it is to have a psychologist on a medical team in terms of coping with a diagnosis like cancer, coping with some of the side effects that managing chronic illness brings up. I teach things like health behavior change and talk to people about medical decision making. As a clinical psychologist, I really found that this sort of sweet spot of working with people on the emotional impact of chronic illness like cancer. Cancer does not occur in a vacuum. It affects not only our health, but our relationships, our work, our finances. It affects everything. So I really value the ability to see how that particular context can affect all those areas of someone's life and helping them to navigate all of those things. We, do shorter term work. Others I might see longer term, depending on the presenting issue, depending on the person and what they have going on in their lives, especially for those we see for the risk-reducing surgeries in terms of the genetic risk clinic. We may see them only a couple of times for psychological evaluation and preparation for surgery, as well as coping before and after surgery to some of the body image adjustments, things like that. For others who we might see longer term, I typically start out every session asking patients what they're looking for from me in terms of support to establish that understanding of what it is that we can work on together and collaborate on those treatment goals. I find it really humbling when people share with me that they don't feel that they can share some of the things we talk about with other people in their lives. And when people trust me with that raw emotional experience, it's incredibly rewarding, and I don't take that lightly.